In this video, we'll talk about retroperitoneal fibrosis. It's also known as Ormond's disease. Coming to the etiology, the main cause is idiopathic. So what is Ormond's disease? This is a retroperitoneal fibrosis which is associated with fibromatosis, Dupuytren's contracture, and then mediastinal fibrosis, plantar fasciitis, Peyronie's disease. And other causes for the retroperitoneal fibrosis can be trauma, infection, drugs, and ergot poisoning, and then urine collection in the space, blood collection in the space, which is called as hematoma, or the tumor, which is malignancy, right? So there are two types of this retroperitoneal fibrosis. One is a localized and second is a generalized. So in the generalized, you can see the involvement of pancreas, duodenal, and the CBD, common bile duct, right? And in the clinical features, so it is a retroperitoneal fibrosis. So you'll see this back pain, right? Because it's a retroperitoneal fibrosis, you can see the back pain, and also fibrosis in the retroperitoneum, which can compress few things like ureter, vessels, and nerves. So in the ureter's compression, there will be dysuria, oliguria, and then frequent renal failures and bilateral hydronephrosis. So what happens? Suppose this is a kidney, right? And these are the ureters. In case of compression of this ureters, the urine won't be passing to the bladder, right? So there will be urine which is collecting up above the ureters and it eventually fills the kidneys. So this condition is called as hydronephrosis. So bilateral hydronephrosis can be seen here. So coming to the vessels, on compression of the vessels you can see this feeble pulse and lower limb edema and the vascular compression. And if the nerves are getting compressed, it can lead to pain. What will be the investigations you'll do? You can do this USG and then CT and ESR and CRP to rule out any infection, which can be again cause of retroperitoneal fibrosis, right? And also urea, creatinine to see the functioning of the kidney. And in the IVU, you can see this three things which is important to remember. First thing, you see hydronephrosis because of the compression to the ureters. And then second, mid 1/3 of the ureter is shifted medially, right? Why? Because of the retroperitoneal fibrosis, this ureters will be getting shifted to the medially. The mid 1/3 of the ureters will be getting shifted medially. And extrinsic ureter compression. Why again extrinsic ureter compression? Because of the retroperitoneal fibrosis, which will be compressing this ureter from the outside, which is called as extrinsic ureter compression. So what will be the treatment usually? If there is any infection, you can treat them with the antibiotics and treat the particular cause of it. And also if there is any hydronephrosis, you can do nephrostomy, right? If there is medial shifting of the ureter, you can shift them laterally. You can reposition it back to the lateral side, right? And also if there is extrinsic ureter compression, you can do erythrolysis. So all this will be the treatment. Now coming to the treatment, first we'll give them steroids like methylprednisolone and also azathioprine. Cytoscopic stenting can be done. We can do bilateral nephrostomy, and for the external ureter compression, erythrolysis can be done. And then erythrolysis, after the erythrolysis, omental wrap can be done after the erythrolysis. So remember, erythrolysis and omental wrap after the erythrolysis, and then lateral positioning of the ureter. So just remember this triad in the IVU, which is hydronephrosis and mid 1/3 of the ureter shifting medially, and then external ureter compression, right? For this you are going to do nephrostomy. For this you are going to do erythrolysis and omental wrap after erythrolysis, right? For this nephrostomy, and for this lateral repositioning of the ureter. So all this along with some drugs like azathioprine and the methylprednisolone will be the treatment. So in the picture you can see this IVU, you can see this bilateral hydronephrosis and medial shifting of the ureter and all. So this is about the retroperitoneal fibrosis. If we summarize the whole thing, what will you see here? First, it's also called as Ormond's disease, which is associated with other fibrosis conditions like fibromatosis, Dupuytren's contracture, mediastinal fibrosis, plantar fasciitis, Peyronie's disease and all. And other causes for this is, apart from idiopathic, trauma, infection, drugs, and ergot, and urine collection, blood collection, malignancy. So two types, local and the generalized. In the generalized, pancreas and duodenum also be involved. And what will be the clinical features? The three main things. It is a retroperitoneal fibrosis. So you can see the pain in the retroperitoneal region, that is back pain. And also fibrosis in the retroperitoneum will lead to compression. So the main thing which you have to remember in the clinical features is compression. So it will lead to compression of ureters, vessels and nerves. Nerves will cause pain. Vessels will cause edema and the feeble pulse, and the ureters will be causing dysuria, oliguria, frequent renal failure, and the bilateral hydronephrosis. So what will you do in the investigations? You can do USG, CT, and then ESR, CRP, urea, creatinine for the kidney function test, and then IVU. It's an important triad to remember in the IVU under retroperitoneal fibrosis. One, hydronephrosis, external urethric compression because of the retroperitoneal fibrosis. So this retroperitoneal fibrosis will shift this middle 1/3 of the ureter medially, right? So coming to the treatment, For this hydronephrosis, you can do nephrostomy. For this, you can do erythrolysis and omental wrap after erythrolysis. For this, you can do lateral positioning of the ureter. Along with that, 2 drugs, which is azathioprine and the methylprednisolone. So this is about retroperitoneal fibrosis. And also, if you want to buy this PDF, which contains all the important questions from this surgery, I have made using SRB, you can text me on the Telegram. Bye.